Our sponsor today is Simplify OR. Simplify OR is the brainchild of Jim Furch. Jim has spent 13 years working in the supply chain side of healthcare, and with this experience, he saw a lot of snafus in the billing system, particularly for implant surgeries. It's an intensive paper process. Usually from the OR, the paper trail moves through 23 departments. There's all this manual workflow. Everybody gets a look at the paper, to make sure the case is billed to the patient correctly, that it's charted to the patient, that they've, updated the materials management system, and that it produces the purchase order at the current contract pricing. So it's really time and management and manpower consuming. So Jim created a software program to automate implant case management. And the first group to use it is a group in Tupelo, Mississippi, practice named Specialty Orthopedic Group. Now, in the last approximately year and a half, they have processed over $14 million in implant cases. And during that time, they have found as much as a 95% reduction in manual workflows. That includes up to an 85% reduction in implant sheet processing, an 85% reduction in purchase order reconciliations, and a 95% reduction in case remediation. So using this software program, they have managed to save this particular practice over 16,000 manual hours. So this is well worth it for any hospital or surgery center that is doing implant cases. So again, we want to thank Jim and Simplify OR for sponsoring us today. So welcome to the Birmingham Medical News Ask the Doctor podcast. I'm Steve Spencer. I'm the founder of the Birmingham Medical News. We actually started the newspaper 20 years ago. It is a monthly newspaper for doctors and healthcare professionals in Alabama, and for that matter, anywhere if you like to read it. I mean, it's a great newspaper, and you can learn all about some interesting healthcare new therapies and topics. Anyway, we do this in partnership with Kassouf & Company. Kassouf is an accounting firm in Birmingham that goes back almost 100 years. They are a full range accounting firm. They do obviously the basic tax accounting, business accounting. They have a wealth management department, and for our purpose or our connection with them, they have a really strong healthcare consulting group. So, Russ Dorsey is the Kassouf head of IT, who actually is here, and Russ not only puts the whole thing together, but edits it and actually does it for us.
And I actually make sure the lawnmower's coming by during every one of these.
Okay, that's right. Russ is in charge of the lawnmower.
Yeah, you're going to hear him in the background for a bit.
Yeah, there he comes. So our guest today is Dr. Jeffrey Davis. Dr. Davis is with Andrews Sports Medicine and Orthopedic Clinic here in Birmingham. And he's got an interesting background. After born in Alabama, but moved to Atlanta by age 7, ended up playing football at Georgia Tech for 3 years before he had a knee injury. What position did you play?
I was a nose guard.
Oh, wow.
Yeah.
I'll be darned. You must have been,
I was a little bigger then,
Yeah.
but players were a lot smaller.
Yeah, that's true.
Also.
That's true. I was going to guess a linebacker.
Yeah, my brother played linebacker at Tech.
Okay.
I was too slow.
But I know that after that, you got an Air Force scholarship for medical school, and then after graduation, became an Air Force orthopedic surgeon, and you ended up with the rank of major. Now you joined Andrews here, I understand, in 1995.
Yes, sir.
What motivated you to join Andrews?
So the opportunity, but I felt was fantastic at the time.
Mm-hmm.
I was from Atlanta. My wife at the time was from Memphis, and I did not want to live in Memphis, and she did not want to live in Atlanta. So we were trying to find something sort of in between. I looked in Nashville and Birmingham and the job. I was at the AOS, which is the Academy meeting, in February of that year, and there was a job posting for Alabama sports medicine at Health South, and so I took it and called and came for the interview and thought this would be a great opportunity. But it was a well-known practice, and some really big-name surgeons were there, and I thought it'd be a great opportunity to come and practice here. I knew a little bit about Birmingham, but I knew that this was the right kind of practice for me, and I knew that this seemed like a good place to be.
You know, I didn't know. I moved here myself with my family 20 years ago to start the newspaper. I didn't know much about Birmingham, but I love the area.
I do too. Yeah, I mean, I've grown to love it, and
Yeah.
I feel really fortunate that I've been able to stay here and raise a family here.
Yeah, and one thing I like too is I love to hike, and we got all the mountains close by. You know.
Yeah.
And one other question with that in mind. So you joined Andrews in 1995, so 30 years ago. It must have changed a lot in that time.
Well, the practice has changed a lot, and obviously healthcare has changed a lot also. But so yeah, we were at Health South Medical Center there,
Right.
which was almost entirely an orthopedic specialty hospital, and it was just really a great place to practice. I mean, it was
Okay.
very conducive to doing orthopedics, cutting edge orthopedics. Again, we had some big names. Dr. James Andrews and
Right.
Dr. Bill Clancy were there. Larry Lee Mack was there, and John Gould, who's a really well-known foot and ankle surgeon, was there. We had Joe Sherrill, who was a third-generation
Right.
orthopedic surgeon. He was there. Kenny Bramlett, and just some really outstanding doctors and surgeons, and really busy practice. So it was a great place to be. And then, of course, they were starting to build us a new hospital, and then Health South imploded.
Right.
With all of that mess with Mr. Scrushy. And then, so we ended up going to, the group kind of split up. And because there was no other hospitals that could take all of us and handle the volume. So some of us went to Brookwood and some went to St. Vincent's at the time. And then, so that obviously changed the dynamics quite a bit. And then they built the orthopedic center at St. Vincent's, and then Dr. Lee Mack and Dr. Andrews split up. And so I came back to join Dr. Andrews at St. Vincent's
Okay.
at that point. And so since then I've been at Andrews, and now we've grown the practice back again. We have 13 surgeons again.
And you've got a lot. If I understand right, you've also got some non-surgical.
We have 9 non-surgical
Yeah.
physicians also, yeah, and then 1 physiatrist,
Okay.
pain management doctor. So it's a big practice, and it's almost as big as it was at the heyday of the Health South time.
Okay.
So we've kind of grown it back to that, and I've obviously seen a lot over. I'm now the senior most partner in the group, which has been interesting. But we've seen a lot, and I'm excited about the future that we have.
And you were a young guy with Dr. Andrews then, right? When he was,
Oh, yeah.
he had a lot of experience. I mean, that must have been a pretty interesting learning experience, I would think.
It was. It turned out to me just seeing how they practice and how they handled patients, and you learned a lot by doing that. I did not have as much interaction with those guys as I thought I was going to have when I came here, because I was used to a very collaborative type practice in the Air Force, because we used to do things together all the time. And in private practice, independent private practice, you really don't work together very much.
Okay.
Kind of each person's doing their own thing.
Okay.
So but still, just you learn a lot just by being around them, and you can certainly ask them questions and watch how they do things. And so you learn a lot by doing that.
And I'm sure, and man, the various famous athletes that have come through there.
Well, and not just
Yeah.
athletes. I mean, it was at the time he was taking care of all the Saudi family.
Are you kidding me?
No, so
Wow.
that you would have these people come in and have surgery.
I'll be darned. And what kind of problems would they have? I mean, I could get it with a pitcher or,
But shoulders and
Be
you know,
darned. Okay.
and some knees and
Huh.
things like that. He would take care of them.
That's amazing. That's news to me.
And then, and you had presidents. You know, President Bush was
no,
here.
I had no idea.
Yeah, and
Would the first George H. Bush?
yeah,
What was he in for?
he came by for a shoulder too, I think.
Oh, that is amazing.
So
All I knew about were the athletes.
No. We had all sorts of famous people would come through. Yeah,
That's
it was
amazing.
it was an interesting time. For sure.
Wow. Well, now to kind of change the subject,
Okay.
one of the interesting things, or I guess something that could have been terrible turned out okay for you. Of course, I understand you had a really bad case of COVID, and
Yes, sir.
I guess it was described as near death.
Yes, sir. It sure was.
Tell us about that.
So, and this was in 2020, and you know the pandemic started in March 2020, and so I actually, I mean, we all assumed we were going to get COVID at some point, just because of the nature of the way it was being passed around, and being in the healthcare community involved with patients. So I actually got it in end of October of 2020.
You went that long
before the vaccine, really right when the immune globulins were coming out, because Saban had gotten it and Trump had gotten it.
I didn't realize Saban had
He got the immunoglobulins and so other people had gotten, but it wasn't available to the general most of us. And so I got it then, and then I was pretty sick for a few days, just like a bad flu case.
Yeah.
And then so I started feeling better. I went to the UAB clinic, a COVID clinic that they had, and they said, "Yeah, you had COVID. Your lungs look pretty bad, but you're recovering." Because I was feeling better. I didn't have a fever at that point. So I went home, expected to be out for a few more days, and then about 3 days after I went home, I started getting short of breath, and my wife ended up calling 911, and they took me to UAB, and I was admitted, and that was the 13th of November, and then I got progressively sicker, and then had to get to the ICU. I was there for a while. They put me on an experimental medication, and I got better.
What was the medication?
Anakinra.
No,
It's an interleukin-1 blocker.
Okay.
And they use it for some special rheumatoid type diseases.
Okay.
But it worked because what happened was it wasn't COVID that almost killed me. It was the cytokine storm that I got from the way my body was reacting to the spike protein or the inflammation. That it got ramped up to a point that's what got me.
So almost like an overimmune reaction?
Overimmune reaction,
okay.
yeah.
Okay.
And so the anakinra tapered that back, and I got better, and I was about ready to be discharged, and then the trial ran out, and so
for the
medicine,
okay,
and they
okay.
took me off the medicine.
Oh, man. And by the way, how long had you been in the hospital about at that point?
Probably 10 days, 2 weeks.
Okay, and some of that time in the ICU, right?
Yeah, most of it was in
Okay,
ICU.
okay.
Yeah. And so I was doing better, about ready. I was back on just the regular COVID floor at that point. And then they stopped the medicine, and then I started getting worse again. And right before they were about to discharge me, I got short of breath again. And then they scanned me, and I had multiple pulmonary emboli, blood clots in the lungs. And so started getting worse again, went back to the ICU, and then I progressively got worse in the ICU. Every day the doctors would come around and say, "Are you ready to be intubated?" And I knew going in that people that got intubated on COVID didn't do well. And so I was fighting as best I could.
Usually they don't come off that.
They usually don't come off the ventilator.
Yeah.
At that point, they did not, because they were they learned later on about how much pressure to use, and they changed the way that they managed these patients, and they started doing better.
Okay.
But this was still pretty early in the disease process. So they weren't doing well. So I fought that as long as I could. I did all the prone stuff that they were doing, and I was lying on my stomach all the time trying to breathe. And so I got progressively worse, and then I started. I didn't know, but I sensed that I wasn't going to do well, and so I called my wife, and we were talking, and I wasn't allowed to see her because of the COVID restrictions, but we would just communicate. And I said, "Listen, here's where all my papers are. Here's where." I started telling her, and she goes, "Well, what are you talking about? You're not going to die. You are not going to die. Listen to me. You're not going to die." And I said, "Well, just in case, these are the things you need to know." And so later on that night, I went into pulmonary failure, and I don't really recall that much. I didn't have any kind of experience or anything. I wasn't scared. It was sort of a peaceful time for me.
Interesting. But you understood what was going on, right?
Sort of. Okay. I mean, I never, but I wasn't frightened.
That's interesting. You knew that it was really
it was bad.
Serious, right?
Yeah, I knew I was sick. Yeah, really
Very
sick. And so
that you weren't frightened.
So they had. So I went into pulmonary failure, and they did emergency intubation on me, and so they tried to intubate me and tried to ventilate me through the ventilator, and I was not responding. So after about 36 hours, they said, we've got to do something else. He's not going to make it. So they called my wife and said, look, we're going to try something sort of experimental called ECMO. We don't know. We haven't had a lot of experience with it, but we think that's his best chance. Okay. And so they had a Dr. Von Meering is the gentleman that did it, and they called. It was an interesting story for my wife to tell it, because the guy called and said, the anesthesiologist called her and said, well, listen, here's what we're going to do. It doesn't look good. I don't think he's going to make it. And she said, no, stop right there. You're not going to tell me he's not going to make it, okay? You're going to say he's going to make it. And are you a believer? Then you're going to pray with me, because we're going to get through this. And so they did all that. And so they did the ECMO. They ended up telling her it was going to be at 1 o'clock in the afternoon. They didn't call her till 7 o'clock that night. So she thought something had gone wrong. Mm-hmm. But because I hadn't been cleared from COVID, they had to keep pushing me back. I had to be the last patient, because they didn't want to put me in the room before the other patients would come in that didn't have COVID necessarily. So it wasn't that it took that long. It's just that nobody called her, and they ended up postponing me all day. So they did it that night.
And sorry, what is an ECMO?
ECMO is they put a tube down my neck into my heart. Ooh. And it's a bypass. It's a lung bypass.
Okay.
So you bypass the lungs, and it's an extracorporeal membrane oxygenation. Mm. And so what it does is it exchanges your oxygen that your lungs can't do it, because I wasn't oxygenating.
Okay.
And so they did that, and I responded really well. I actually woke up about a day later, not knowing what had happened. Of course, woke up slowly, but then started recovering, started getting better. Was transferred to a different unit, and so after about a week after that, I started getting out of bed, and now I would walk around with have all these people behind me carrying all of the equipment, and so started getting therapy. And so I was on ECMO for about 3 weeks to get my lungs time to heal.
Oh, I didn't realize. I assumed it was a short-term procedure.
No, it was 3 weeks. And it was a little bit frightening coming off of it, because I depended on it, because I could see when it wasn't on, I could watch my oxygenation fall. So
the second you get up,
so the fear of coming off of it, it was a little bit of a fear, because I just didn't know how that was going to go. Mm-hmm. But I ended up getting off of it, and I got out New Year's Eve. So I was there for about 7 weeks in the hospital.
Yeah.
And then
perfect time to get out.
Then it was it's not. I was hoping to be home Christmas Eve, but it didn't work out. But it was New Year's Eve.
Kind of neat that you got out New Year's Eve.
It was good, and then I went. Had to go to pulmonary rehab, and because I went home I was on oxygen full time. I was on a walker because I couldn't walk very far. I was really, really weak because I'd been in bed for so long. And then, so I had to do the rehab. Special moments were the first time I got to go back to Andrews with my oxygen, and I walked, and everybody stood and clapped for me. It was really, I mean, they're family to me, and it was just a very special moment. Yeah, it was a very special moment then. And then I got to go back and practice I think it was end of March.
So you were out
5 months.
Okay.
Total. Yeah, I was out for 5 months. And then I went back and started seeing patients in March, and then started operating in April.
Okay.
And then I was back full speed by end of May. So then I've been back since. And so I pretty much fully recovered. I have some mild residual scarring in my lungs, so I get a little bit short of breath if I really exert myself. But other than that, I have no other residuals from it, which is a miracle.
Really? Very true.
It's a miracle. I asked the doctors at UAB, I said, so how many other people have you had like me? And they said, none.
Right.
None.
Because, and I've heard so much about long COVID.
Yeah.
Which sounds just so sad for people.
Yeah.
But I can imagine going through what you went through and not have, I mean, we're talking, so essentially, well, 7 weeks in the hospital, 5 months to recover. I'm really, that is pretty amazing that there wasn't some kind of residual.
And it really is. I mean, when I got it, the disability people at Social Security called me and say, so we're going to start your disability papers. I said, I'm not going on a disability. I'm not that. Because, well, we read your records. We thought you'd be on disability. I said, no, that's not my style. I'm not going to.
Really,
not going to do it.
Really fortunate.
So yeah, it is.
Let me, and I don't want to take you off. I want to get back to what track you're on, but I'm really interested in kind of the mental or emotional part. First thing that sticks with me is that when you called your wife and was talking to her about where paperwork was and all that, so that's just interesting to me. And I don't know if you have any comment that you knew that. Just instinctively that things were getting bad, and it was only that night when things got really bad. Do you think about that at all? I mean, just the fact that somehow it didn't sound like you were having your symptoms were worsening, but you kind of knew. It seems like. Yeah,
I mean, I think that you get urgings, and you get. I think. I mean, I believe in our power, and I believe in God, and I think if you're tuned or listen, then He will help guide your mind, and so I think he kind of led me to that where I needed to be at that point. So I mean, I think that's what happened for me anyway.
And you said that I think you said that at some point, was it that night when it got really bad? At some point, you said you weren't scared. I think maybe that was when you were close to dying.
Close to dying. I mean, it was I was not. I don't recall being frightened at all. I mean, it was sort of a peaceful. Did
Did you think to yourself, "I'm going to die"?
I did not. Because in my head, I mean, I never planned to die. I did not want to die.
Yeah.
I did not desire.
But yet, are you telling me that you knew you were?
I mean, I sensed that I was getting sicker. Okay. But it was not. I did not know I was that close to death at the time.
You.
But I knew it was a possibility or probability if I kept getting sicker. I mean, it was because my lungs were getting worse, and so I mean, there's only so much I can do.
I just didn't know if you literally knew I'm 5 minutes away and had that. No,
I did not. No, because my goal was to keep fighting for my breath.
Yeah.
I mean, I wanted to keep breathing, keep living.
Right, of course.
So that's what I wanted to keep doing.
And again, I'm just going through the emotional parts. So when you got out of the hospital and you started, the slow recovery, did you have any fear that, about, am I going to relapse or, anything like that? Did you? Because I'm thinking that during the time there was at least several points in which you were getting better and then got worse.
Right.
Did that fear ever?
No, because I mean, at that point I had been I mean, that happened a lot. It was a lot of yo-yoing early on in the disease process. But once that last 3 or 4 weeks was, I mean, a trajectory upwards only. I mean, I never did really go back again.
Okay.
And so when I got home, I mean, I felt pretty confident that I would continue to. I didn't know what my end point would be. At that point, I didn't know if I could get back to doing what I love to do. I didn't know how far it would go, but I knew that was my goal. I mean, that's what I wanted to do. The fear was just, the only fear I really had was the uncertainty of what this meant for me as emotionally, physically, that I was, and then there was some uncertainty of what I do about my health. You know, how do I take care of myself going forward?
You mean
for everything, but including, because I asked the doctor, I said, so do I need to get a vaccine? I mean, I've had the disease. Do I need to get it? Yeah. So when do I need to get it? Nobody knew. Nobody can answer me that.
Yeah.
You know, once you've been sick, that's sick. I mean. So it was a lot of unknowns, and I tried to teach myself about that. But there, as you know, it was a very complicated time, and there was a lot of politics in the COVID situation. Yeah. So it's very hard to get good factual information about what was best for that. So anyway, but it was a very trying time for sure.
And I know before we started filming, you had talked about the emotions afterwards, after you were healthy. Right.
So, yeah, for me, again, I'm not that emotional a person in general, but when, after I had that experience, I mean, when nurses would come in and the kindness that people showed me, I would just tear up. I was so thankful for what people did for me, the generosity of people, the things that the people in the OR at St. Vincent's, they collected gifts from different people, and they brought me a big basket of different things that I could use in the hospital and things that reminded me of them or whatever. It was just very, very sweet things like that. I had my wife was an absolute pillar of strength throughout this whole thing, and she fought for me. And I would say one of the things I learned from this experience is you need a patient advocate when you're in the hospital. I'm convinced that, because if you just rely on people taking care of you, they have, I mean, they want what's best for you, but they don't always know you and what's best for you individually. You have to have somebody there fighting for you to make sure that everything is being done best for you. So my wife was fantastic in that. And then I had 3 other guys, 2 of my partners, Andy Cordova and Jeff Dugas, and then Tommy Tomlinson, who's an anesthesiologist in town. Those 3 guys guided my wife with the medical part of it, and they fought for me, and they would call people and make sure I was taken care of. And I still get teary when I think about how much they gave of themselves for me during that time. I mean, it was just phenomenal. The number of people that were praying for me is pretty phenomenal. I had people walking around the hospital doing prayer walks for me, and just throughout the community. I still meet people today, almost every week, that says, "I'm so glad you're well. I prayed for you in that time." And it's, it's very humbling to think about the number of people that were involved in me getting better.
It's nice. Nice.
It's fantastic. Yeah.
And humbling, I think, is the right word.
Yeah,
for
it's
that
very
too.
humbling. Yes.
Yeah. It's really beautiful.
Yeah, I'm curious. How's this affected your empathy with patients?
A bunch.
Yeah.
A bunch.
Can you expand on that? I think it's a great question.
Yeah. So, a couple other things about it. I guess from a perspective of how I treat patients now, I think number one is I try to see them as more than a problem. You know, rather than just having a hip problem or a shoulder problem or a knee problem. I try to do a little bit more. I mean, I'm not fully on the whole person thing, but I do try to learn a little bit about them and try to be more empathetic about their situation. It's taught me that. And also just what's best for them and trying to, if they don't have somebody that can advocate for them, I want to be that person, try to be that person, because I know you can feel helpless in a hospital with everybody telling you what it's very demanding and you have very little input. And me as a physician, I still, it was pretty amazing what was done to me, even though I tried to control some of it. It was still just pretty crazy how it's just a big machine that will run over you if you're not careful.
Okay.
But the empathy part of it, I think you do learn a lot. Again, humility. We don't know all. We never will. And so you have to acknowledge that for patients and try to be empathetic about their situation.
Yeah, and also assume a little bit of humility about life, because I find it for myself, the older I get, the more I sort of am aware of my mortality.
Right.
Because when I was 20, 25 years old, you don't even think about getting hurt,
Right.
And I think an experience like you had with your mortality almost come to an end has to really humble you to realize, how fortunate we are. And I think about myself, I've never really had a health problem, and I'm so lucky because there's so many people, as you well know,
right,
that have continual, somebody with kidney disease,
right,
or so many people have.
Well, so many people battle so many things, and a lot of them are unseen. There's a lot of emotional scars,
right?
A lot of mental things that people battle with, and we don't see those things,
right?
But they're part of the person, the whole person. And I think we all have to realize when we meet somebody, we don't know their story. We assume, but we shouldn't. We should give them a bit of time to explain or to.
We don't know. Because almost everybody has got some scars or have had some hurdles. And
sure. So I think the brevity of life, that was brought home to me big time. I knew that already because my dad died when I was, 3.
Oh man. Okay.
So I knew that we're not guaranteed anything.
Yeah.
But still, it's when it happens to you, it's really brought home.
I think
and
so.
I was healthy. I was 60. I was healthy. Had no medical issues. I was not on any medications. Had no history of anything. So I was not in one of the big risk groups.
Yeah.
I was a little overweight, but not bad.
No, you really weren't in.
I don't know why it hit me the way that it did, but it was just kind of a random thing.
And I think I agree with you on the idea that we don't realize our mortality until it affects us. Because my father died relatively young. He died at 53. He actually died of lung cancer. Never smoked a cigarette in his life, but he was ROTC in college, and he was at Camp Lejeune, and that was one of the
Yeah.
But the point is, obviously, I was sad when my father died, but you don't really come to grips with how, as you just described, we're not guaranteed anything until you experience it.
Right. No, it brings it home for sure.
Yeah.
For sure.
Well, that's been really interesting, and I thank you for giving that to us. And I think what we'll do, we're gonna come back for a part 2, where we want to talk about what you do with joint replacement, some of the things in your practice.
Sure.
But
Love to.
I want to thank you a lot for telling us about your experience and for visiting with us today. And
absolutely.
And we'll carry on with part 2.
Okay. Excellent.
Thank you for listening to today's episode of the Ask the Doctor podcast, brought to you by the Birmingham Medical News and Kassouf & Company
Please make sure to like and subscribe, and make sure to tune in for our next installment. I'm Steve Spencer, and wish you and your loved ones a healthy journey until we see each other again.